Yes, records available to us indicate that the said Ogechi was actually admitted in our facility.
Okay.
This last weekend, Saturday.
Okay.
And then she left on Sunday. Doctors saw her. Some tests were written for her, but as at the time she left, no surgery had been booked for her. In the course of her treatment and in the for the test to be carried out, that may have been when the cannula was inserted in her hand. But FMC is not a one-man hospital. We have a lot of teamwork, so different levels of staff, nurses, doctors, the lab scientists, everybody works together to arrive at the diagnosis for the patient and come up with proper treatment. So if she had videos with all those paraphernalia, as you said, it may have been in the course of her treatment.
What tests were carried out on her? What were the results, if any, since you've seen her folder?
Okay. Well, every patient has a bill of rights.
Yeah.
And we do not have the right to divulge the patient's medical information.
Okay.
Because every patient is entitled to confidentiality, except if they give us written consent to divulge that information.
All right. So I saw the lady yesterday at the police station, and we interacted too. And by virtue of that interaction, we got to know that she claims to be a nurse as well. And the truth is that with some of the pictures we also saw, with some of those lines and cannula stuff, some appear not to be even at the hospital bed, taken at the hospital bed. Yes. And going by what she told us, a nurse or whatever, we also want to believe that, who knows, she may have, because there was one other lady we also saw or met at the police station. The DPO was also interacting with that lady, who perhaps is the lady Susan said she sent to meet her at her place. Actually told us too how she, fixed some kind of lines on her body and all of that. They pulled up those things, looking bloody and all of it. So most likely some of those pictures may have been taken at home too. Yes. Just like what the head of clinical services said, Ogechi actually came to the hospital on Saturday and was admitted. Now, her leaving the hospital truly was against medical advice.
Okay.
Yes. We have also seen that record. Ogechi was asked to do certain things, but she opted, not to stay in the hospital anymore.
Who then discharged her?
Certainly, when she signs against medical advice, there's no way we could retain or keep her there. It would be like, keeping her against her consent.
Then someone would discharge, someone would say, well, this patient is refusing to follow what we want her to do.
Yes.
And as such, I am letting her go. Who did that?
That record is there. There's something called discharge against medical advice.
All right.
So if the team managing you says you still need to stay to carry out some investigations, but you say you want to go, it's not a prison. If they give you a form and you now sign that you have discharged yourself against medical advice.
Do we have that? Do we have that in our folder?
Yes.
It's in our folder like that.
Yes, we do.
All right. So does it also show how much she expended in all of this? How much, if she has receipts in those folders to show that she paid for some medication, she paid for the bed, she paid for anything? Does she also have that in the folder?
The receipts
The receipts are there.
folder, yes.
The receipts are in the folder.
Yes.
But you cannot tell us exactly how much.
What was paid to the hospital, those receipts are there.
All right. Who be the person who give her that paper? Make I ask you that in question in pidgin. There should be a name right in the folder?
Yes.
Is there a name there?
Yes.
Will you present that to the police also? You'd have to present
if the police ask
if
for
they
any
ask.
records. Ogechi, we have records. Our available records show that Ogechi was admitted in our facility on the 22nd of February, that was on Saturday, and discharged herself against medical advice on the 23rd, which was Sunday. We also have records to show that she was admitted last year, November, for some days before being discharged. But at no point was any operation carried out on her in the Federal Medical Center Yenagoa.
Whether in November last year
Whether
or
in
this year?
November last year or February this year.
What does the record say for what she was admitted for in November?
Like I said, the patient bill of right does not allow us to divulge her medical diagnosis, except if she gives us written consent.
Sir, I want to say something.
Go ahead.
I want to say something before I forget it.
Go ahead.
The woman said that there is a case that showed that she was admitted last year November for some days,
Yes.
and she got discharged too.
Mm.
But there was no traces of oppression. Now, this is taking us back to the foundation that raised over 1 million naira for her. And she went to FMC, lie down on the bed, took pictures, and sent to that foundation and told them that she has undergone the surgery. That was how those people's money went. That means in my own case now, she also got admitted. The plan was also to lie to me that she has done the surgery. But this time around, the benefit come up with that. So who is that doctor that she has been doing this thing with? Who is that doctor that she has been doing this thing with? You know should talk, oh. That's my talk, oh. That's my talk, oh. Do you know how much we raised for this girl? And the money is no longer in her account. You know the man?